In this video, we're going to discuss the role of blood thinners for stroke prevention in AFib and answer the question, do you really need them? Far and away, the most feared and devastating effect of AFib is the potential for stroke. The most common type of stroke is when part of the brain dies due to lack of blood flow, and this can occur in AFib because blood clots can form in the heart and travel to the brain. AFib can increase your risk of stroke, and that risk is higher with an increasing number of risk factors for stroke. For example, 2 risk factors more than doubles the risk of stroke, and all 8 risk factors increases the risk of stroke by over 12 times. The risk factors for stroke are age greater than 65, there's an even higher risk for those over 75 years of age, having high blood pressure, having a history of stroke, TIA or mini stroke. This is a particularly powerful predictor of stroke risk and counts double the other risk factors. Being female, having a history of congestive heart failure, having a history of vascular disease such as a heart attack, stent in your arteries, bypass surgery or blockages in your peripheral arteries, or a history of diabetes. To assess risk more clearly, doctors typically use a risk score called the CHADS-2 VASC score. This risk score considers all of the above risk factors and is used to calculate an annual risk of stroke. For example, if someone's risk score is 2, they have a 2.2% chance of stroke per year if not taking blood thinners. Someone with all of the risk factors or a score of 9 would have a 12% annual risk of stroke. So now you know how your risk for stroke is determined and what the CHADS-2 VASC score is. So how do doctors use this information to decide if you should take a blood thinner or not? Although there may be other factors considered, when the CHADS-2 VASC score is 0 in a man or 1 in a woman, most physicians do not recommend blood thinners. When the CHADS-2 VASC score is 2 or more in a man or 3 or more in a woman, most physicians do recommend blood thinners if there is not a high risk of bleeding. When the CHADS-2 VASC score is 1 in a man or 2 in a woman, this is controversial, with some doctors recommending blood thinners and others do not. I think this is an excellent opportunity for the physician and the patient to have a shared decision-making conversation to see which approach makes the most sense. So blood thinner medications decrease the risk of stroke by about 70% and the risk of death by about 25%, but of course at a slightly higher risk of bleeding. If you have more questions about blood thinners for AFib, check out our other videos on which blood thinner is right for you and how do you know if your bleeding risk is too high. And as always, I recommend talking to your doctor to understand better whether you need a blood thinner medication for your AFib. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.